everyone, I am Dr. Neha Jain. I work as a consultant neonatologist and pediatrician at Rainbow Children's Hospital, Sarjapur Road. Today I'll be talking to you about fever, what is it, how to measure it, what to do if your child gets fever, and when to get the child to the hospital in case the child has fever. So our normal body temperature is 98.6 degree Fahrenheit or 37 degrees Celsius, and it varies 0.6 degrees Celsius up and down. So many of the times parents will say the child is looking very hot, so I touch the child and the child has fever, but I'll tell you that's not an accurate way. So what is the accurate way and what is the temperature at which we call it as fever? So by books it's said that rectal temperature of 100.4 degree Fahrenheit or 38 degrees Celsius is called fever, but we don't measure the temperature by rectal route. So where all we measure the temperature, we measure from the mouth, from the armpit, we can measure it from the forehead, from the ear. So oral temperature of 100 degree Fahrenheit and above and an armpit temperature of 99.5 and above is taken as fever. In kids who are less than 6 months, we prefer to take the temperature through the armpit. In kids between 6 months to 5 years, we can take the temperature in the armpit, we can take the temperature from the forehead, that is we go from this side to this side, that is from one temporal area to another temporal area, and it's done by an infrared thermometer which will detect the heat waves at your skin, and it can even be detected in your ear canal, which is called the tympanic membrane, where we check the temperature. Kids above 5 years, even oral method can be used, that is we put the thermometer below the tongue and we can take a temperature. The non-contact thermometers have got very famous during the COVID times, but it's good for screening, but it has a poor accuracy. So we would not promote to use a non-touch thermometer. Say you record a temperature for your child and it comes in a range where you can say it is a fever, then what to do? First thing I will say is don't panic. Let the child wear comfortable dress, loose clothes, hydrate the child well. Say it's the first time you are seeing a fever and you don't know the medication, do approach a doctor for a proper dosage of the medicine to be given, or if you have used it before and you know it and it's readily available, give a dose of paracetamol medication. Yes, tepid sponging can be done, but it's done with lukewarm water between 28 to 30 degrees Celsius, and it's optional. So main thing is to give the oral medicine. With that you can add tepid sponging, but only tepid sponging may not work for the kid. The other thing is, why did the child get fever? So yes, fever is protective. It actually tells us that there's something wrong going on in our body. Any infection, inflammation in the body will cause our brain to raise the temperature bar and we get fever. There are many reasons. It could be infection, it could be post-vaccination, drugs, dehydration, autoimmune process, and so long. But for pediatric practice, we generally see viral infections as the most common cause of fever. Now another question is, when should we get the child to the hospital? Any child less than 3 months getting fever, any child who has a fever more than 104 or fever persisting more than 5 days, or a child who has fever associated with lethargy, irritability, crying episodes, headache, neck rigidity, or any breathing problems, any abnormal behavior, abnormal movements you see, yes, you should contact the doctor. The next common question asked is, my child doesn't eat properly during fever. Yes, the appetite will go down because of the aches, pain the child goes through. Sometimes there may be a taste change which the child will face. In that case, make sure you hydrate them well. Give them small sips of water frequently, light meal. If the hydration is proper, then it should be fine. But suppose a child doesn't take anything, yes, that's another indication you should come to the doctor, or the child vomits up all the food, then yes, you should contact a doctor. The last question is whether the fever which the child has is high grade, whether it will cause brain damage or it will cause fits in my child. So there is an entity called febrile seizure, but high fever and febrile seizure are not the same. Febrile seizure is a disease which is seen in kids between 6 months to 5 years of age. Generally, they may have a family history of similar condition, they have genetic predisposition in such scenarios, and they usually outgrow by 5 years. But yes, all high fever will not cause the child to have fits or damage the brain. Intensity of fever is not really associated whether the child would get fits with that or not. Thank you very much.